A warm welcome to all our viewers to our series Natural Medicine. Today we are going to discuss the Lyme disease. This is also called borreliosis. I would like to take a look behind it. Is it a widespread disease or a plague which is spreading more and more, or is that not true? What can we do about it to get rid of this problem? Or can you not get rid of it at all? I would like to know all of this today from an outstanding physician whom I have been following and knowing for 30 years. Back then he also managed this world-famous Paracelsus clinic in Switzerland and helped it to achieve world fame. Today he manages the Sonnenberg Clinic in Switzerland. I look forward to hearing what he has to say about this topic. It's Dr. Thomas Rau. Stay tuned, we'll get started right away. And here we are again. And now I can show the guest. Dear Thomas, welcome to the studio.
Good.
Good start. So Lyme disease.
Thank you very much for having me.
My pleasure.
For this very important topic.
Is it a plague? Is it a widespread disease? Does it spread? Can we treat it? Can we get rid of it? Or do we have to live with it? 5 questions.
Yes. Well, Lyme disease had been known for a long time. This is the tick-borne bacterial disease. Borrelia burgdorferi is the causative agent. I learned that many years ago when I was a student, I was allowed to learn it. So this is nothing new. Only Lyme disease has changed its face. Fundamentally. And today it has found enormous distribution. In America, this condition is known as Lyme disease. Yes, Lyme is a small town in Connecticut, which is on the East Coast. The climate there is similar to that in Thurgau or in Schaffhausen, for example, a humid climate. There are many lakes there and there are many deer in the woods. Very similar to ours. And why am I saying this? Because it has become so common here, too, because these carriers, namely the deer, are then bitten by the ticks. The ticks absorb it and it doesn't bother them. Later, the tick can also infect humans. That is, the tick bites and sucks blood. When the tick has sucked up blood, after a certain degree, then there is pendulum blood. And it sucks in, but because the pressure is greater a bit goes back in and then the human gets infected. This is how this infection with Borrelia occurs. This Lyme disease then causes, these tick bites cause it. And there are good studies also along the Rhine. This was then tested primarily on the Baden-Württemberg side. And it was found, for example, that school children along the Rhine on the German side, that was this investigation a few years ago, that they had already had Borrelia to over 80%. But they are not sick at all, they are completely healthy.
So antibodies, so to speak?
Yes, they have antibodies. That is, the presence of the antibodies is not a disease. And unfortunately, there is a problem today that it is tested if you don't know what you have. Then at some point you also test for Borrelia and then you find positive antibodies.
It's good, but still no certificate that you are ill.
Exactly. I got to go to a convention in Massachusetts about 15 years ago about environmental medicine. There were also immunologists, there were toxicologists, it was a huge congress. So I was invited to speak about Lyme disease. There was a speaker before me, I didn't know him, and he said, from Washington up to Maine, they examined the whole East Coast for the accumulation of Lyme disease, because in America, especially on the East Coast, Lyme disease became a huge problem.
Die Häufung der Borreliose, weil in Amerika, vor allem an der Ostküste, ist dieses Lyme disease, ist ein Riesenproblem geworden.
And he found that the reason this condition became more problematic was due to toxicological exposure.
Dieses Leidens abhängig war von toxikologischer Belastung.
In fact, he found that exactly the same as the frequency of the disease in the waters of this industrial region or area of the world was just parallel.
In den Gewässern dieser recht industriellen Region oder Gebiet der Welt halt eben parallel war.
Where there was more toxicological heavy metal, in particular mercury and lead pollution, people got sicker from Lyme disease. That is, this bacterium has its dignity, as they say, its behavior and its disease-triggering power from the heavy metal load. Today we are in a different world. It is also known in the organic scene that Lyme disease, stage 3 Lyme disease, and if you don't know, then you test for Borrelia antibodies and you find antibodies. Yes, but you can find them in every peasant boy along the Rhine in Baden-Württemberg, and you will find these boys or these children very healthy, or in forest workers you'll find the antibodies. The presence of the antibodies does not mean that people have to get sick from these bacteria.
But that's how they treat it.
And there was a huge propaganda made. First of the pharmaceutical industry to give antibiotics. Then there were all of a sudden quite a lot of Lyme or borreliosis specialists, all over. They sprouted from the ground and then treat people with antibiotics. We in the organic scene, we also treat them, but not with antibiotics. But now it may sound arrogant, at the Sonnenberg Clinic in Schwelbrunn we have practically 100% success rate, but I do not treat against the Borrelia. I detox people from the toxins. Because the Borrelia can only form their stage 2 or 3 when they are in this toxicological environment situation inside.
Again,
it's always the same. And we can turn their benignity back by detoxifying the body and calming down the bacteria, with the fantastic means of the Sonnenberg Company in northern Germany, so to speak, who just have bacteria-altering drugs.
Fantastischen Mitteln der Firma Sanum in Norddeutschland, welche eben bakterienverändernde Medikamente haben.
Natural medicines, fantastic cures. We treat patients with the Sonnenberg Company products. But also, and now I come to the most important thing, namely the Lyme disease patients that we then find if we also look at other neurotropic, so nerve-impairing viruses, they always have high virus levels, always.
Das heißt, die nervenbeeinträchtigende Viren auch schauen, haben die immer hohe Virenwerte, immer.
The Lyme disease patient, the so-called, who was mostly treated through partly even pseudo-biological practices, was treated with antibiotics for months without sense, has toxic loads, almost always mercury, and has other viral loads.
Toxische Belastungen, fast immer Quecksilber und hat andere virale Belastungen.
Now there's even something else coming. I'm getting a little excited now because that's so bad.
Das ist so schlimm.
The antibiotics, which are then the second stage, because the first stage, these are the normal doxycyclines, usually do not work sufficiently. The second stage is the Rocephin. And the Rocephin has mercury in it as a stabilizer. And the patient only becomes more toxic. A work of the devil. This is simply not necessary because whether the Borrelia become pathogenic or not depends on the patient's environment.
Pathogen werden oder nicht hängt vom Milieu des Patienten ab.
And if we change this environment, then these bacteria become harmless again, as they are in healthy people anyway.
Wieder harmlos, wie sie bei gesunden Menschen ohnehin sind.
I have an important question. One always hears that there are Borrelia that are infected and others are not infected. What does that mean?
Yes, the Borrelia are infected. It's actually about concomitant infections, Bartonella and Babesia. These are the typical accompanying bacteria which come together with the Borrelia. These are animal pathogenic bacteria that may also be present. But we must think of this. Even the biodoctors who always say everything depends on the environment. Suddenly, with Lyme disease, they don't say that anymore and give antibiotics. It's bad.
Well, I've learned something great again. Thank you very much.
I ask my organic colleagues, how do I treat Lyme disease? And when they come up with antibiotics, they don't get it.
But there is also, I had that once with my son who had a tick bite and then we saw a long red line already down. That means there was actually a budding blood poisoning here, wasn't it?
No, it is like this. The stage 1, this occurs in those regions where the humidity and temperatures agree. In approximately 30% of tick bites, this stage occurs after 10 to 20 days.
Dieses Stadium 1 nach 10 bis 20 Tagen auf.
So it goes for a few days, but it can also be shorter nowadays, the incubation period. And then you say, here is the tick bite, then a ring forms, a redness, and then this redness goes outwards. There is such a ring-shaped erythema, and that is stage 1. Well, if you catch that, then I'll inject it with our biological agents or conventional medicine then gives antibiotic therapy, and this is justified. 21 days is recommended nowadays. Mostly it is given for 10 days with doxycycline.
But you could also do it differently instead of using antibiotics.
Yes, we always do it differently and we don't have a transition to stage 2 in the cases that we treat in stage 1. And stages 2 and 3 are stages that are no longer associated with Borrelia. These are either joint problems, so arthritis, mostly of the large joints, or then stage 3, but it is rare, these are neurological diseases.
Now I know a few doctors who call themselves Borrelia specialists and work with interval hyperhypoxia therapies, for example. And they explained it to me in such a way that in a low oxygen area, so high altitude training, little oxygen, the Borrelia bacteria come out of the joints. Then you smack oxygen on them again, and when they get that much, some of them die and the rest retreat. Well, now I'm a bit confused. Do they even have Borrelia or not?
It is like that. We do this interval training here in the Sonnenberg Clinic in Schwellbrunn too. This is a fantastic method, a stimulus method where you can improve bacteria, but above all the microcirculation, you can improve the oxygen uptake capacity of the cells. Brilliant therapy for coronary heart disease, angina pectoris, and so on. It is also effective against viral and bacterial diseases, because then the cells become more resistant and healthier and are able to defend yourself better. I don't see it as if these bacteria migrate out because they don't have enough oxygen now. It is a very intensive milieu therapy, so the inner milieu of the person, the metabolic environment, is treated, and that is why it works so well. I'm not sure what it does to the bacteria, because it's not the bacteria, it's the antibodies which make an antibody reaction. At stage 2 and 3. I don't see it as the nasty Borrelia tick bacteria go there and eat up the nerve. This is an antibody-antigen reaction.
I would like to make a short summary again. So, when a normal doctor measures antibodies, they immediately treat Borrelia with antibiotics, where actually existing antibodies say nothing else than your immune system is activated and actually has a normal immune response. So that doesn't mean I'm sick right now, does it? It could already be over. The pathogen could be gone by now.
Exactly, the Borrelia antibodies, they stay for a very, very, very long time. And it is doubted, not only by me, but also immunologically, whether the bacteria are really still active or whether only bacteria decay products are present and the body then still develop antibodies against these foreign proteins or particles, the destroyed bacteria. And then we have an antibody-antigen reaction, an immunological as well as an autoimmune reaction. And it's not the bad bacteria eating around, alive. They are no more.
But again, maybe for slow thinkers too. When my body produces antibodies, then it must actually be able to eliminate the pathogen in the body.
Yes, it should. That's why it's making antibodies, that the white blood cells, so the macrophages, activated by the lymphocytes, these are the immune reactions, then go and eat up those particles. And when they eat them, they get broken down enzymatically in the granulocyte, in those white blood cells, because there are enzymes in there, and then they become inactive.
And that's most of the cases.
That's most of the cases. An intact immune system, and that was the problem now, when we no longer have an intact immune system, either overstimulated because many other substances are still present or a toxically caused underability, an underactivity of the granulocytes and lymphocytes, then this processing can no longer be done.
Der Granulozyten und Lymphozyten ist, dann kann dieses Verarbeiten nicht mehr gemacht werden.
These people then have these antibodies forever.
That means antibodies alone are okay, but if the Borrelia survive in the body, why do they survive if I have antibodies? I don't understand that either.
If they survive at all, if they are not waste. You have to imagine that you are being given an antibiotic or the body notices, oh, wrong bacteria are coming along and destroys them, then they aren't dissolved into thin air. They are still there, dead or decayed. And this bacterial dirt, so to speak, is still there and antibodies are also produced against it. Therefore, subantibodies are determined where you then examine flagella or the cell wall particles of Borrelia. As antibodies.
And if someone now comes to stage 2 or 3, somehow 10 years later, after this tick bite, and stage 2 is because they just suddenly can't move their knee, or only with a lot of pain, then what do they have? Did they have antibodies against this tick bite for 10 years? And is there still Borrelia in the knee, or is there a reaction in the knee due to the antibodies?
There's a reaction in the knee because of the antibodies.
Indeed. That's all different.
I have a very stubborn case right now that keeps coming back to with pain in major joints or almost always, knees, elbows, shoulders, but mostly elbows and knees. Again and again totally bad effusions, so swollen. And I have done blood tests several times. They were always positive for antibodies. I also looked at the punctuation. We do these punctuations and local treatments, and there were antibodies, but no bacteria. It was a sterile effusion. These are not the bad bacteria that you can then cultivate. They weren't there anymore. Then we have treated this patient as a polyarthritis patient and boom, he was well, although in the classic sense. Well, of course he wasn't well. Polyarthritis is a very long story.
What is polyarthritis?
A rheumatism. This classic rheumatism with many joints is called chronic polyarthritis. This is simply the articular rheumatism. It's always or almost always an autoimmune problem.
But here, because of the antibodies, the idea was that it's Borrelia. And it wasn't.
And for this patient it would have been classically indicated, because he had very strong Borrelia antibodies. Also had, as it should be, according to conventional medicine, antibiotic treatments, even several times. And that didn't help at all, despite the diagnosis that was made because of the antibodies.
I'm very surprised and amazed again. The antibody thing, you are a bit more open now. I have antibodies to a current virus, so I have to say, okay, I had the infection once, my body reacted and took up the fight. The matter is settled. I've never noticed or felt anything, everything is fine. That means if I bring it over to Borrelia, if I have antibodies to Borrelia, the fight is over in my body, my immune system has won. It's okay. But that the medics then treat it immediately for Borrelia, based on an antibody test, although the immune system now does it itself, this has now become very questionable and surprising for me. And once again the confirmation that everything is different than you think.
Exactly. I still have to give credit to the immunologist. A differentiated doctor distinguishes between IgM, which are only positive if the bacterium is still there, and IgG. They are, as you said, a long-lasting immune reaction. And when the IgM is elevated, that is in the child who is bitten, gets a circle afterwards, the IgM are always high, the bacteria are there. That's why it has to be treated very quickly, with antibiotics. But not the large number of so-called Lyme disease patients, they are not Lyme disease patients. And that was then, and I have to say that quickly. In advertising a few years ago, it comes back every spring. Now you need to vaccinate against tick bite. Well, this is tick-borne encephalitis, a viral, very rare disease that is vaccinated against, and not against Lyme disease. You cannot vaccinate against Lyme disease. This is a scam, as we would say now. It is a misdirection of the ignorant layperson. Now you have to be vaccinated against Lyme disease. This happens to people more and more, but it isn't true. You can't vaccinate that. Vaccinations are against tick meningoencephalitis.
That ultimately means meningitis.
Meningitis, which is incredibly rare.
Oh God. Thank you very much for this very valuable episode. For you, dear viewers, that was Professor Dr. Thomas Rau from the Sonnenberg Clinic, and I have been able to learn a lot again. I hope you too. And maybe at home for you now the danger or fear of walking through the forest or across the pastures is no longer quite as great. Because if you have a good, healthy immune system, then it may very well be fighting it with great antibodies produced against it, so that we no longer have to avoid or think that fear must triumph here too and prevent us from taking those wonderful walks in the woods. So definitely not. Thank you very much for watching. See you next time.